educator at the University of Ottawa. Welcome back.
Thank you very much.
Anecdotally, I tell you, it's definitely showing up in my life with friends and colleagues, some of them who've already had COVID-19, who might have COVID-19 again, or people that are getting it for the first time. How about you?
I'm still a COVID version, knock on wood. So I'm one of, two people in the city who have not yet had it? Me and my spouse.
I haven't had it either, actually, but everybody around me has had it.
Yeah, it's not surprising. It's not surprising. One of the characteristics of the new subvariants of Omicron is the remarkable ability to reinfect, to achieve this thing called immunity escape, which is concerning, because there is some convincing data that with every reinfection, you increase your risk of a bad outcome. So unlike other diseases where infection seems to confer some lasting immunity, these variants and subvariants of Omicron are doing the opposite. So we should be avoiding infection as much as we can, in my opinion.
I suppose I should say I have not had it that I know of.
That you know of.
I haven't had any symptoms of it. I suppose I could have been asymptomatic. I should stress that. Raywat Deonandan, what do you think we need to be doing locally about this?
Well, I think the days of restrictions are over. That's a good thing, right? No one wants to shut down businesses. No one wants stay-at-home orders. No one wants school closed. And the reason that those days are over is we have the right tools to use to control, to some extent, our infection rate. Number one we have to do is start using our masks more liberally. I think it was a mistake to release the mask mandate provincially, but locally we could certainly take strides to reintroduce them for all public indoor spaces. So if you go to the grocery store, the Canadian Tire, whatever it might be, a movie theater, wear a good quality mask like an N95. Number two, if you haven't been boosted yet and are eligible, you should get boosted. And we should open up those fourth boosts to everyone over 18 immediately. Number three, if you are a parent of a child who's not yet been vaccinated, definitely do so, because by the time school opens up, they will be better protected. And we should be seeking ventilation solutions. So if you haven't got a portable HEPA filter in your house, think about getting one or building what's called a Corsi-Rosenthal box, which is a cheap HEPA filter that most of us can afford to make on our own. Most important thing that we kept to do is just fix the messaging. I think for some reason the narrative that the pandemic is over has become prevalent. It's not over. And it doesn't mean our lives have to stop. It just means we have to treat the virus and us and each other with a bit more respect and be aware that infection is still a thing. So we got to fix that message and remind people that the vaccines and the masks work, despite the fact that people keep projecting endless misinformation to the contrary. So those aren't difficult things to achieve to my mind. They just take some focus and attention.
Right. Ontario, as you know, has been under increasingly vocal pressure now to expand eligibility for the second booster or the fourth dose of the COVID vaccine beyond people who are 60 and older, because right now it's 60 and older, immune compromised, Indigenous populations. It sounds like they're going to do that next week, doesn't it?
It really does, and thank goodness for that. Now, whether that was followed by an actual availability of doses and a streamlined booking system is another story entirely. But yeah, it looks like at least that will be fixed soon.
Right. But at the same time, we're talking about these bivalent vaccines. How effective is the current booster, the fourth shot, in dealing with BA5?
It's a good question. No one really knows for sure. The issue with the bivalent vaccines is that they are tasked toward the original Wuhan strain and the Omicron variant. But Omicron is pretty much gone now, replaced by BA1, BA2, BA4, and BA5. So even the bivalent vaccine is shooting at a target that's no longer there. The question is, do the antibodies produced by the original strain and this bivalent strain, are they still functional against BA5? The evidence suggests that probably is, and the evidence is limited, and based on animal studies and things like that. And the bivalent vaccine produces enough antibody titers to suggest it'll prevent a strong sense of infection. But at the same time, the fourth dose might do the same thing. We're not entirely sure. To me, the big confounder is, even if you want to wait for the bivalent vaccine, it may not be available in any meaningful volume to us locally in the fall. So that's why I think we should seek to get a fourth dose of the existing vaccine while we have it available. Nothing prevents us from seeking a fifth dose later in the year if you're eligible.
It always feels a bit absurd during COVID because we're asking people like yourself, Raywat Deonandan, an epidemiologist, what do you think's going to happen? What do you think's going to happen? And constantly you're trying to read the tea leaves. But just to back up, to ask it a different way, did you ever foresee that we would be in this situation right now in July, in the summer?
When this first started, I thought this would last 4 years. And so about a year ago, when it looked like it was only going to last 2 years, I felt pretty stupid for thinking it would last 4 years. Now I feel like maybe it'll last more than 4 years. I am surprised that the vaccines didn't put a deeper blunt into the transmission. But I shouldn't be surprised because the variants came about. So let's reconsider what I just said there. I'm not saying the vaccines don't work. I'm saying the disease changed. The vaccines worked fine. The disease changed. So given the fact that this disease seems to be mutating faster than anyone thought it would, it's not surprising that we are looking at higher levels of transmission than we thought possible. What I am surprised at is our inability to summon the appropriate political and public will to do the appropriate things to curtail transmission. That's disappointing.
But this is when the psychology of the pandemic comes in. And I know that's not necessarily epidemiology, but it's part of it. It's human behavior. It's one thing, and I was sitting on an OC Transpo bus today coming in. A lot of people were wearing masks. Actually, more people were wearing masks than when it was mandated, just in my opinion, from my own experience. And there was actually an announcement that came on from Dr. Vera Etches where she says, "Hi, I'm Ottawa's Chief Medical Officer of Health, and I recommend that you wear a mask when you're on public transit." I do wonder, though, how many people are in a position where they've taken the mask off and now they've decided, I'm not putting it back on.
Yeah, it's a good question. And that's the danger of doing away with those mask mandates, is it's hard to put them back in when you need them. Not just mandates, but encouraging people to wear them when it's needed. Will masks be worn in schools in the fall? It's a big unknown. I think they might be. I think the clever boards will, at the very least, will recommend them in classrooms, especially since the vaccination rate amongst children is not great. But the question of psychology is an interesting one. And as we move forward in the post-pandemic world even, considering how to manage and to unroll public health in a psychological milieu will be foremost in many people's minds. And we can't disentangle this from politics. So many disingenuous players have pushed bad messaging for political gain and have been fomenting distrust of experts, distrust of doctors, distrust of the media, again for political gain. All of this was unanticipated, at least by people like me.
Raywat Deonandan, thanks very much.
Thank you very much.